Right. But to give every American health care is a basic right. But why do we also have to say you lose your options? A UK hospital, a French hospital, a Swiss hospital do not get different rates based on the way in which a person is insured. So your argument about rates is an interesting argument, and Larry suggests it's right. But the idea that you're pinning that on weirdness on Bernie Sanders, I'm just telling you, 54 other countries have it. Every other OECD country has some form of universality in which everybody's rates are paid at the same level. So that argument doesn't make sense. I'm sorry, but you're wrong about that. They have universal health care, but they don't have a single-payer system. I'm clear about that. In fact, I'm very clear Medicare for All is a single-payer system. No, it's not. Yes, it is. It's a single-payer system. It's an Medicare for All is not an insurance system. It is an insurance system. Medicare is an insurance payment. It's a payment that reimburses something that's charged. That's not how the single-payer system works. That's not how the UK works. That's not how the Canadian system works. That's the confusion. Medicare for All is a single-payer insurance program. I know what Medicare is. Yeah. Do you know what Medicare Advantage is? Yes. What is Medicare Advantage? Program that is over and above the basic costs of Medicare that most people get because Medicare doesn't pay the full cost. It's actually not more expensive than Medicare. You get it for the same price of Medicare. Right, and they give you better benefits. No, this is important. Medicare Advantage, if you and I were turning 65, we could choose Medicare Advantage. It doesn't cost us anything else. We get more benefits under Medicare Advantage. We have lower copays. It's a higher cost program. No, it's not. It's not higher cost to you, but the cost of the program is higher. It's not. The government pays Medicare Advantage providers the same rates they pay Medicare. So who pays the extra cost? If you're getting more out of Medicare Advantage than you are out of Medicare, they run it more efficiently. Because they have networks and they manage the care. Right. So if you were to choose what a larger system, a universal system does. But Medicare doesn't do that right now. Right. And so that's why Bernie Sanders is calling for Medicare for all so that everything's networked. I'm not saying. But Ollie, what you just said about Medicare Advantage is just not true. Right? Medicare Advantage is an option that our seniors get. John, they don't pay anything more for it. I understand, John, but whether the senior pays for it, the insurance system pays for it, the government pays for it, your private insurance pays for it, there are higher costs and lower costs, right? So when I say something costs more and you say it doesn't cost the user more, it costs the system more. So the United States pays more than double what all industrialized countries pay for health care. Right. That's a cost that might be borne by you. It might be borne by your insurance company. But there's a reason for it. Right? If you need a specialist, if you need a specialist in the UK, right, it's not emergency care. You got to wait about 9 months. That's just not true. It is too true. I just had a friend of mine who had a hip replacement in the UK. They had to wait 9 months. Represents everybody. Okay, I'm just saying. I think you got to have your facts right. Medicare for all. My facts are 100% right. The gentleman from Kaiser just confirmed it. So Medicare doesn't pay the cost of health care. That's a fact. Private insurance pays twice what Medicare does for hospitals. If every hospital were reimbursed at the Medicare rate, they would close. So what's your answer to that? But what's your answer to that? My argument is you're basically arguing that hospitals should close. I'm not. I mean, this is economics. You're an economist. You got to understand the economics. For me, that's fine. I'm not making that argument at all. And what's your argument to the 150 million Americans who are going to lose their health care? Why would you lose your health care under Medicare for All program? By definition, because it makes it illegal. I'm not going to get a word. Here's an example. What if this new Medicare for All program doesn't reimburse mental... all part means everybody gets it. There are 11 basic health benefits, the guaranteed health benefits that were there under Obamacare. I'm not arguing it's a better deal. I'm just telling you your argument that people are losing health care under it is incorrect. It is correct. It's just not correct. The for all part means for all. Okay. But it's not the same, but it's your choice. How do you know the Medicare for all benefits are going to be the same? Again, my dad, the union electrician, he loved his health care that he got through the IBW. If my dad were alive today and I were to say to him, Dad, you got to get off that IBW, and trust me, we're going to have this great new government plan, he'd be like, let me see it first. I hear you why people would be frustrated. I'm just saying it is coverage for all people. It may not be at the level that you're used to when your insurance company pays twice as much as Medicare. I think that's understandable. Okay, right? so what are the people who then have... But they're not losing their health care. I never said they lost their health care.